is about antimicrobial agents or antibiotics. Antibiotics are components can produced by microorganisms or some fungi in natural situation, and sometimes maybe synthetic or artificial. They have harmful effect on other microorganisms, but it has no effect or at least program and complication on cells, on human cells. Each antibiotic or each antimicrobial agent have one character or selective toxicity. Selective toxicity. Selective toxicity means effect of antibiotic on other microorganisms, other fungi, other protozoa, with at least effect and complication for humans. Each antibiotic is bacteriostatic or bactericide or bactericide. Static means inhibition microorganisms, and side means killing of microorganisms. A good antibiotic has bacteriostatic and bactericidal effect near to others. In laboratory situation, we have two phrases, MIC and MBC. MIC derived from bacteriostatic or minimum inhibitory concentration, or at least or minimal level of antibiotic that inhibit the growth of bacteria in bacterial suspension in laboratory situation. But bactericidal or MBC, minimum bactericidal concentration or at least level or minimum level of antibiotic that kills microorganisms in bacterial suspension in laboratory situation. MIC is synonym to bacteriostatic, of course, in vitro situation, and MBC is synonym to bactericidal. Each antibiotic has two coverage on microorganisms. Some antibiotics have narrow spectrum. It means the antibiotic is effective on one species or one genus. For example, vancomycin is effective on Staphylococcus aureus, or isoniazid is drug of choice for tuberculosis. Specific and significant effect of antibiotic or effect on species or genus, special genus and special species. Some antibiotics have broad spectrum. It means it is effective on some genus and some species. For example, doxycycline or tetracycline. Covers some genus and some species of bacteria. all of antibiotic categorized based on 5 mechanisms. First, inhibition of peptidoglycan synthesis. Or cell wall inhibitor. As you know, the most section of cell wall is peptidoglycan, especially in gram-positive. We have thick layer of peptidoglycan. And also in gram-negative, we have a thin layer of peptidoglycan. The first group of antibiotic inhibit of cell wall or peptidoglycan. The second group inhibits cell membrane. I have told you before, cell membrane has 5 duties for bacteria. Transfer of some material just as food, electrolytes, water, delegation in peptidoglycan synthesis, excretion of some enzymes, and also chemotoxic effect. And some antibiotic inhibit cell membrane function. Some antibiotic inhibit DNA synthesis. As you know, DNA is so important for bacteria for replication and transcription. This group of antibiotics inhibit DNA synthesis and also DNA replication also. The fourth group of antibiotics inhibit protein synthesis. The genetic information of DNA must transcripted to mRNA or messenger RNA, and then the genetic information of messenger RNA must translated to protein on 30S ribosomes and 50S ribosomes. And finally, we have inhibition of protein synthesis. Inhibition of proteins in synthesis in some antibiotics. And finally, we have inhibition of metabolic reactions. Some antibiotics inhibit metabolism of bacteria. In bacterial cell, we have some growth factors, just as amino acids, just as vitamins, and some other growth factors and proteins. In this group of bacteria, inhibit these metabolism factors and control the synthesis of some material that is necessary for bacteria. Now, we talk about each mechanism and the important antibiotics in each group. In the first group, we have inhibition of peptidoglycan. First, what? The second, inhibition of cell membrane. Third, protein. Fourth, DNA. And finally, metabolic reactions.
So this antibiotic is the kill of the bacteria or not?
It is only on bacteria. Of course, some of antibiotics may be affect on fungi and protozoa. For example, some inhibitor of cell membrane are so important for control of fungi. I will tell you.
Kill the bacteria. Kill or inhibit the group of antibiotics.
All of antibiotics have one of these mechanisms. For example, some antibiotics inhibit peptidoglycan, some of them cell membrane, some of the DNA synthesis, not all of them. Of course, maybe one antibiotic used from 2 or 3 mechanisms, but not all of them. Not all of them. In human cells, we have no peptidoglycan. In human cells, we have no peptid. But in bacteria, we have peptidoglycan. And this group of antibiotics have so benefit for human cells and at least effect on human cells. And very good antibiotic for treatment, this group of antibiotics. The most important and the most famous antibiotic of this group is penicillin. Naturally, penicillin produced by Penicillium notatum. Penicillium notatum. It's a kind of fungi. Naturally produced by Penicillium notatum. Penicillin has bactericidal effect. Bactericidal, killing the microorganisms. And effective on gram-positive cocci and bacilli, and also effective on gram-negative cocci, penicillins. Penicillin has broad spectrum effect, broad spectrum. The main nucleus of penicillin, is 6-amino penicillinic acid. The main nucleus. It has a pentamer for thiazolidine, and a quarter or beta-lactam. In attached to beta-lactam, we have our substitution. Each component in this section maybe causes another form of penicillin. We have some type of penicillin based on substitution in our sections. We have 6 types of penicillins. And penicillin have 2 mechanisms of effect. In bacterial cell wall, we have a kind of peptidase enzyme, a kind of protein. This enzyme causes transverse relation in the cell wall. Penicillin inhibits these enzymes. Penicillin controls these cements, or PBPS, or penicillin binding proteinase, and also destruct the cell wall. And also, this is the first mechanism. The second mechanism is inactivation of some inhibitor in cell walls. And activation of murein hydrolase. Murein hydrolase destruct the cell wall. Murein is autolytic. And destruct the cell wall of bacteria. What is the first mechanism? The first mechanism, inhibition of penicillin binding proteinase or peptidase enzyme. And the second mechanism, Activation of murine hydrolase and destruction of cell wall. I told you we have 6 types of penicillins. The first penicillin is penicillin G or natural penicillin. Penicillin G or natural penicillin. We have 3 types of natural penicillins. Procaine penicillin, long-acting penicillin or benzocaine penicillin, and crystal penicillin. There are 3 types of penicillin G or natural penicillin. Procaine and crystal have faster effect, and benzocaine is prophylactic with long-acting effect. The second group is acid resistance. Acid-resistant penicillin or penicillin V. Penicillin V. It's kind of oral penicillins, and is effective for control and prevention of Streptococcus group A, not for treatment, only for prevention. Streptococcal group A. Acid resistant. This group of penicillin is resistant to gastric acid. The third group of penicillin is beta-lactamase resistant. Beta-lactamase or penicillinase resistant. Some bacteria produce a kind of enzyme or beta-lactamase or penicillinase can destruct the beta-lactam structure of microorganisms. Yes? This group are resistant. Beta-lactamase resistant, just as oxacillin, cloxacillin, naphthalene, and methicillin. They are the sample of penicillin resistant or beta-lactamase or penicillinase resistant. Oxacillin, cloxacillin, naphthalene, and methicillin. Methicillin is so important in nosocomial infection or hospitalized infection, or resistant to antibiotic in hospitals. And for control of this group, or MRSA and MRSE, methicillin-resistant Staphylococcus aureus and methicillin-resistant Staphylococcus epidermis. Salam. We need another antibiotic, vancomycin. Vancomycin in resistant form of bacteria or MRSA or MRSA, we need another antibiotic or vancomycin. The fourth group of penicillins are aminopenicillins. Just as ampicillin and amoxicillin. Ampicillin and amoxicillin. They are so effective, special on gram-negative bacilli gram-negative. Of course, amoxicillin some effect on gram-positive bacteria. For example, in sore throat, in angina. The fifth group of antibiotics effective on Pseudomonas, anti-Pseudomonas, anti-Pseudomonas penicillins. As you know, Pseudomonas is ubiquitous. You can see the bacteria everywhere, and it's so resistant to antibiotics. Pseudomonas aeruginosa is so resistant bacteria. And this group of antibiotics is so important because decrease the morbidity and mortality rate, just as carbapenicillin, piperacillin, ticarcillin, azlocillin, and meslocillin. They are anti-Pseudomonas penicillin for effect on resistant form bacteria, just as Proteus, Enterobacter, Klebsiella, and Pseudomonas. Ticarcillin, carbapenicillin, piperacillin, azlocillin, and meslocillin. And finally, welcome. The sixth group is inhibitor of beta-lactamase. This group of antibiotics have binomial nomenclature or two sections, just as amoxicillin, clavulanic acid. This section inhibits beta-lactamase, and this section inhibits cell wall synthesis. And ampicillin, sulbactam, and ampicillin, tazobactam. There are two section antibiotic. One section inhibit beta-lactamase or penicillinase, and the other section control peptidoglycan synthesis or destruct of cell wall. It was the first antibiotic of first group. What was the mechanism of first group?
Penicillin G.
Penicillin G can inhibit peptidoglycan synthesis. Well, you tell me, the first antibiotic of first group? Penicillin G, or natural penicillin. The second? Penicillin weak or acid resistant. The third? Resistant to beta-lactamase. The fourth? Aminopenicillin. The fifth? Anti-Pseudomonas penicillin. And the last, inhibitor or beta-lactamase or penicillinase. The second antibiotic can inhibit peptidoglycan synthesis and is so important for human and treatment are cephalosporins. Cephalosporins are a good substitution for penicillins. Cephalosporins. cephalosporins. Cephalosporin naturally produced by a kind of fungi or cephalosporium, just as penicillin, Penicillium notatum. Cephalosporium. It has broad spectrum effect, effective on gram-positive and gram-negative bacteria. The main nucleus is 7 cephalosporanic acid. 7 cephalosporanic acid. And it has 2 sections in main structure, hexon or dihydrotiazine, and also second section is beta-lactam. And also it has 2 type of R section. And the number of cephalosporin is much more than penicillins because we have 2 R substitutions. The mechanism effect of cephalosporin is just as penicillin. Inhibition of peptidoglycan synthesis or cell wall inhibitor. We have 5 generations of cephalosporins. 5 generations of cephalosporins. First generation, just as cephalexin, cephalotin, cefalzolin, and cefalpiridine. The first generation is effective on gram-positive bacteria, special on gram-positive bacteria. The second group is cefuroxime, cefoxitin, cefamandel, and cefaclor. They are second generation. They are effective on gram-negative and also some effect on gram-positive. And also, this group of penicillin can pass from blood-brain barrier and are so important in meningitis treatment because they can pass from blood-brain barrier. Cefuroxime, cefoxitin, cefamandel, and cefaclor. The third, maybe please give for me a pen. Thank you so much from Education Office. The third group are so important antibiotics. They are so effective on resistant form and gram-negative bacteria, special on gram-negative and sometimes single dose, just as cefixime, ceftriaxone, ceftazidime, cefotaxime, cefoprazone, cefdizoxime, and moxalactam. They are important sample of third generation of penicillin. These group are effective on gram-negative bacteria and resistant form, just as Pseudomonas, Enterobacter, Proteus, and Klebsiella. And also in some gram-negative cooks, just as Neisseria gonorrhea and Neisseria meningitidis. Yes, this group can pass from central nervous system and so effective. For example, I told you Neisseria meningitidis for control and treatment of meningitis. Yes. And some of them, just as cefixime, is single dose in each day. Single dose in each day. The fourth group is cefepime or oxypime. Thank you. The fourth group is cefepime or oxypime, and also cefprom or cefrom. There are fourth generation of penicillins. They are so effective on gram-negative and also some modification on gram-positive. And some gram-positive bacteria may be affected by cefprom and cefrom. And finally, the last group of cephalosporin is ceftaroline. It's the newest cephalosporins. We have 5 types of cephalosporins. The first, cephalexin, cephalotin, cefazolin. Second, cefoxitin, cefuroxin, cefamandor, and cefacalor. Third, cefixime, ceftriaxone, ceftazidime, cefoprazone, oxalactam. And the fourth group, cefepime or oxypime. And the last group, ceftaroline. All of this group, penicillins and cephalosporin, can inhibit peptidoglycan synthesis or cell wall inhibitors. Some other drugs, some other important drugs or antibiotic can inhibit peptidoglycan synthesis are vancomycin. I told you vancomycin is effective on MRSA and MRSE in hospitalized patients. Methicillin-resistant Staphylococcus aureus and epidermidis. Vancomycin is so effective. Other important drug is carbapenems. Just as imipenem, meropenem, ertapenem, and tianamycin. They are carbapenems. Imipenem, meropenem, ertapenem, and tianamycin. And also, this group of bacteria is effective on gram-positive and gram-negative bacteria, and also obligative anaerobic, just as Bacteroides fragilis, obligative anaerobic. Another group are monobactams. Monobactam, just as Ostreonam. Aztreonam is effective on gram-negative bacteria, but it has no effect on gram-positive bacteria. Aztreonam. And miscellaneous antibiotics are cycloserine, bacitracin, and teicoplanin. Cycloserine, bacitracin, and teicoplanin have inhibitor of cell walls. I have told you we have 5 mechanisms for effect of antibiotics. The first is cell wall inhibitor, just as penicillins, cephalosporins, vancomycin, carbapenems, monobactam, and some other, just as teicoplanin, bacitracin, and cycloserine. About the first section, any question, any suggestion, please? Any comment? For first group. The second group is inhibitor of cell membrane. Inhibitor of cell membrane. As you know, the cell membrane has 5 duties for bacteria. Transport of some material, just as food and electrolyte and water, delegation in peptidoglycan synthesis, respiration of bacteria, excretion of some enzyme, just as protease, amylase, pectinase, and some other, just as lipase, and also chemotoxic effect. Now, this group of antibiotics or inhibitor of cell membrane divided 3 groups. This group of antibiotics divided 3 groups. Some of them causes disintegrity of cell membrane. Disintegrity of cell membrane, just as polymyxin, B, polymyxin E, or colistin is so important antibiotic, resistant for polymyxin E or colistin in gram-negative bacteria, just as Pseudomonas is so important, colistin. And also tyrosine and daptomycin. They causes disintegrity on cell membrane. The second mechanism is pore formation. Pore formation, just as gramicidin and valinomycin. And third mechanism is effect on fungi or antifungal drugs. Antifungal. This group divided to polyens and imidazole. Polyen, just as nystatin and amphotericin B. And imidazole, just as ketoconazole and miconazole. Ketoconazole and miconazole. Antifungal drugs inhibit ergostrol and lanosol on cell membrane. They causes inhibition of ergostrol and lanosol on cell membrane. Well, the second mechanism is inhibition of cell membrane. The first group antibiotic with this integrity of cell membrane, just as polymyxin B, polymyxin E, daptomycin, and also tyrosine. The second group, spore formation, just as gramicidin and valinomycin. And third group, antifungal, just as nystatin, amphotericin B, and also miconazole and ketoconazole, antifungal drugs. This is another pen. This is so bright. We talked about antibiotic. Chemotherapy or antibiotic therapy, the use of drug to treat infectious disease. About selective toxicity, I told you it has harmful effect on microorganisms with at least effect in human cells. Antibiotic produced naturally or synthetic or artificial. Two modes of action, bacteriostatic and bactericidal. And I told you about MIC and MBC. MIC equals with bacteriostatic effect and MBC equals with bactericidal effect. And in the other section, disadvantage of antibiotics. What is the ideal antibiotics? Have the appropriate spectrum of activity for the clinical setting. It must be near MIC and MBC of antibiotics. Thank you so much. Have no toxicity to the host or selective toxicity, but harmful effect on microorganisms and no effect or at least effect on host cells. Low propensity for development of resistance, or at least resistant to antibiotics. Not induce hypersensitivity in the host. For example, penicillin causes allergy or anaphylaxis after injections. Have rapid and extensive tissue distribution. For example, cefixime has rapid distribution in the body. Have a relatively long half-life, just as cefixime and third generation of cephalosporins. Be free of interaction with other drugs. Cross-reaction and interaction between penicillin and other antibiotics and other drugs is so important. Be convenient for administration, for example, oral or injection, and be relatively inexpensive, just as penicillins. I told you about the spectrum of antibiotic, narrow spectrum and broad spectrum. Narrow just as isoniazid and vancomycin for treatment of tuberculosis, and spectrum broad just as tetracycline, doxycycline, chloramphenicol, covers some genus and species. You can see, for example, tetracycline have broad spectrum, control some bacteria just as gram-negative, gram-positive, chlamydia, and rickettsia. But isoniazid is narrow spectrum, only on mycobacteria, or polymyxin only on gram-negative bacteria, or vancomycin only on Staphylococcus aureus or gram-positive bacteria. I've told about 5 mechanisms. Of course, in this section you see 4 mechanisms of effect of antibiotics. Metabolic reaction as movement. I told you about cell wall inhibitor, penicillin, cephalosporins. Beta-lactam just as penicillin and cephalosporins, and carbapenem and meropenem. You can see about type and kinds of penicillin. I told you 6 types of penicillins and about 5 generations of cephalosporins. We will read in the future, of course, about vancomycin, bacitracin, all of them inhibit, and also fosfomycin inhibit cell wall. And about cell membrane, I told you, and divided 3 groups. Penicillin is cell wall inhibitor. Beta-lactam, yes, they have. Beta-lactamase, some bacteria just Staphylococcus aureus can inhibit beta-lactam, but you need to beta-lactamase inhibitor. Just as, for example, amoxicillin clavulanic acid, amoxicillin, tazobactam, and sulbactam. They inhibit beta-lactamase enzyme. Well, the third group and the third mechanism effect of antibiotics, inhibition of DNA synthesis. As you know, DNA has 2 roles and duty: replication and transcription. Replication and transcription. This group of antibiotics inhibit replication and transcription. The most important antibiotic of third group are fluoroquinolones. Fluoroquinolones. It is from narrow spectrum to broad spectrum. Narrow spectrum is nalidixic acid. Nalidixic acid or Negran. And broad spectrum is ciprofloxacin, ofloxacin, norfloxacin, and the strongest is moxifloxacin. Moxifloxacin. This group of antibiotics inhibit DNA gyrase enzyme. DNA gyrase enzyme and inhibit DNA replication. Nalidixic acid, ofloxacin, norfloxacin, ciprofloxacin. Nalidixic acid is only effect on gram-negative bacterial urinary tract infections, but another one, just as ciprofloxacin, is effective on gram-negative bacteria and also some gram-positive bacteria, just as Enterococcus and Staphylococcus aureus. The coverage is wide. And the mechanism effect is DNA gyrase inhibitor. And also another antibiotic in this group is metronidazole. Metronidazole, of course, metronidazole is not fluoroquinolone. It's separated antibiotics, metronidazole or flagyl. It controls obligative anaerobic bacteria, just as Bacteria fragilis. And also, it is so effective on some protozoa, just as Trichomonas, Giardia lamblia, and Entamoeba histolytica. Some protozoa, just as histolytica moba, just as Giardia lamblia, and also on Trichomonas. It causes laceration or rupture of DNA. It causes laceration and rupture of DNA. Well, you tell me the most antibiotic of DNA inhibitor. The first, nalidixic acid or Negram. The second, fluoroquinolone, just as ciprofloxacin, ofloxacin, norfloxacin, and
Flagell.
and also flagyl or metronidazole. All of this group can inhibit DNA gerases and control inhibition of DNA synthesis. Any question?
Can we take a break for 5 minutes?
You want break?
Yes.
5 minutes, yes, it's okay.
It's okay.
Of antibiotic is inhibition of protein synthesis. As you know, protein synthesis have 2 steps. The first step is converting of genetic information of DNA to mRNA or messenger RNA. And the second step is translation of mRNA information to proteins on 30S ribosome and 50S ribosome. It is important 30S and 50S. I told you before the importance of 30S ribosome and 50S ribosomes. Some antibiotic of this group only inhibit transcription or RNA polymerase enzyme inhibitor. RNA enzyme polymerase inhibitor. Just as rifampin, rifabutin, actinomycin, novobiosin, and clofazimine. They are the most important antibiotic can inhibit RNA polymerase enzyme. From this group, rifampin is one of the best antibiotic for control of tuberculosis, and clofazimine is used for leper disease. The second group of antibiotic can inhibit protein synthesis are aminoglycosides. Aminoglycoside just as azogamycin, streptomycin, gentamicin, tubramycin, amikacin, kanamycin, and neomycin. They are important sample of aminoglycosides. This group of antibiotic causes inhibitor of initiation complex of protein synthesis, and also causes misreading on protein synthesis, translation of protein, misreading of protein synthesis. This group of antibiotics are bactericidal and effect on gram-negative bacteria, some intracellular bacteria just as chlamydia and rickettsia, and also on mycoplasma, and another group of this group, and sometimes effect on mycoplasma or non-cell wall bacteria, mycoplasma. These antibiotics inhibit 30S ribosomes protein synthesis. They inhibit protein synthesis on 30S ribosomes. Some antibiotic can inhibit 50S ribosomes, important of course, or macrolides. Just as erythromycin. Azithromycin, clarithromycin, and telithromycin. There are good substitution for penicillins. Substitution for penicillins. Erythromycin, azithromycin, clarithromycin, and telithromycins. Effective on gram-positive, gram-negative bacteria, and also in some bacteria just as Bordetella, Legionella, Mycoplasma. I prescribe this antibiotic, for example, in respiratory tract infection and sore throat. They are good antibiotics, just as erythromycin. And with widespread or broad spectrum azithromycin and clarithromycin. The macrolide inhibit translocation of protein synthesis on 50S ribosomes. This group control protein synthesis on 50S ribosomes. The previous was 30S. Important antibiotic can inhibit protein synthesis on 50S ribosomes is lincosamide. Lincosamide, just as oxazolidinone, lincomycin, clindamycin, lincomycin, clindamycin, and oxazolidinone. This group of antibiotics can inhibit protein synthesis on 50S ribosomes. Another important antibiotic can inhibit protein synthesis on 50S ribosome is streptogrammin. Or dalfopristin, quinopristin, or sinercid. Streptogrammin or streptogramidin, just as dalfopristin, quinopristin, or sinercid, can inhibit 50S ribosomes. And the last antibiotic of this group is chloramphenicol. Can inhibit protein synthesis in 50S ribosomes with inhibition of peptide synthesis. On 50S ribosomes. This was the fourth group. Any question? The fourth group. You tell me the fourth group. What's the mechanism?
Inhibit the protein synthesis.
Very good. And some sample, for example, the first group RNA polymerase enzyme inhibitor, just as RNA inhibitor, just as rifampin, rifabutin, clofazimine, novobiosin, actinomycin, and aminoglycosid, just as kazolgamycin, streptomycin, gentamicin, tubramycin, amikacin, kanamycin, neomycin, and 50S ribosome inhibitor, just as macrolide, just as erythromycin, azithromycin, clarithromycin, erythromycin, and lincosamide, just as lincomycin, clindamycin, and oxazolidinone, and streptogramin, or dalfopristin, quinopristin, or sinercid, and finally chloramphenicol inhibit 50S ribosomes. There are samples of antibiotics. This is so important for your examination. You must know the mechanism and important antibiotics. The fifth mechanism is inhibition of metabolic reaction. In the bacterial cell, we have some growth factor, just as vitamins, just as amino acids, some proteins, and some essential factor, just as folic acid. This group of antibiotics can inhibit metabolic reaction, are divided two groups: competitive, and non-competitive. Important competitive antibiotics with fifth mechanism are sulfonamide, dapsone, trimethoprim, cotrimoxazole, and isoniazid. Their mechanism is competitive. Sulfonamides, dapsone, trimethoprim, cotrimoxazole, and isoniazid. Sulfonamide inhibit dehydropetroate synthetase enzyme. Dapsone also just as it. And trimethoprim can inhibit dehydrofolate reductase enzyme and can inhibit folic acid. And cotrimoxazole is combination between sulfonamide and trimethoprim. Cotrimoxazole is synergistic antibiotic between sulfonamide and trimethoprim. And isoniazid, drug of choice for TB, and analogous of niacin and pyridoxine. All of them inhibit folic acid synthesis, but isoniazid inhibit niacin and pyridoxine, or vitamin B5 and 6. The mechanism of this group was competitive. The only non-competitive enzyme and antibiotic is flow-cytosine. Effective on fungal disease and causes DNA defective mutation. Because it inhibits a kind of enzyme or thymidylate synthetase enzyme. Thymidylate synthetase enzyme. Well, how many mechanisms for control of bacteria? How many?
5 mechanisms.
5 mechanisms. First, yes. Second, peptidoglycan or cell wall. Third, DNA synthesis. Fourth, protein synthesis. 5, metabolic reactions. They are the 5. All of antibiotic are in this one of this group. As you know, all mechanisms. Sometimes we need to prescription 2 or 3 antibiotic for control and treatment. It is some situations. When we have hyperacute infections, sometimes we have hyperacute infection. We need to some antibiotics. Second, we have polymicrobial. For example, we have abscess formation. In abdominal and cerebral abscess formation, we have some kind of antibiotics. Sometimes we have chronic infections, just as TB, just as a leper. It needs some antibiotics. Sometimes we need to synergistic effect of antibiotics. For example, cotrimoxazole. Cotrimoxazole is combination between sulfonamide and trimethoprim. I told you before. Cotrimoxazole has antibiotic with combination of sulfonamide and trimethoprim and can inhibit folic acid or metabolic reaction. And sometimes you need to secondary infection control after viral infections. Secondary infections. They are the sample that you need 2 or 3 prescription of antibiotics. When we have 2 antibiotics, the A antibiotic and B antibiotic, combination of A and B is indifference. Indifference or neutral. It's better only one antibiotic because it's indifference. Sometimes we have A, B. A and B is summative or additive. Summative or additive. Combination of 2 drugs is better than 1 drug because it has summative or additive. Sometimes we have A, B. A and B is very good. This is synergism. Synergism. Because the time for killing of bacteria is very good. Synergism, just as cotrimoxazole or trimethamine sulfonamide for control of toxoplasmosis. And sometimes you have A, B. A and B is very bad. Antagonism. For example, penicillin and chloramphenicol is not good choice. Or tetracycline and gentamicin is not good choice. When you prescribe bactericidal and bacteriostatic, it is forbidden because it has antagonism effect. Antagonism effect. When we have two antibiotics, the first, A and B, the first situation is indifference or neutral. The second, summative or additive. Third, synergism is a good situation, and antagonism or bad situation, just as bacteriostatic and bactericidal prescription. Any question? We have some disadvantages on antibiotic prescription. One, some disadvantages of antibiotic prescription. Allergic reactions. For example, in penicillin injection, maybe allergic or anaphylaxis or urticaria or itching or pruritus. Sometimes we have toxic effect on tissues. Toxic effect on tissue and organs. Third, disturbances of normal flora, because normal flora is important for safety and body. And finally, we have drug resistance to antibiotic. We have some drug resistant to antibiotic. For example, when you consume incomplete antibiotics, or when you have accessible antibiotics, or when you add antibiotics to food of veterinary and some poultry, it causes resistance to antibiotic and it is ineffective on bacteria. Well, who is your representative? Please, absent and present person, all of them? Yes. Please write your name.
Super.